You ever been at the dentist? They mention words like crown or bridge, and you just kind of nod along? Yeah, me too. They're super common ways to fix teeth, but what are they really? Well, today, we're going to pull back that curtain and make sense of it all.
So, here's the game plan. We've got these incredible, authentic, handwritten dental notes, and we're going to use them as our guide. First up, we'll solve the empty space mystery. Then we'll dive into engineering your smile. After that, we're weighing the options. And finally, we'll lay out your dental blueprint.
All right, let's jump right in. Section 1, the empty space mystery. See, before we can even talk about the fixes, we've got to understand the problem. And trust me, it's a much bigger deal than you probably think.
So let's just ask it straight up. Why is one missing tooth such a big deal? I mean, it's so easy to just write it off as a little gap, right? Something that only affects your smile. But the truth is, the consequences go way, way deeper than that.
And wow, when you see it laid out like this, you really get it. We're talking about maintaining the actual shape of your face. It's about being able to chew your food right and even how clearly you speak. But look, it goes even deeper. It affects your jawbone, and yeah, it can even impact your psychological well-being. This is about your whole health, not just one little gap. And look, losing a tooth can happen to literally any of us. If you look at our source notes here, the reasons are all over the map. It could be from getting older, diseases, a freak accident, or even habits like grinding your teeth at night. It's a really common problem, but with some very real consequences. Okay, so we get the problem. Now for the good part, the solutions. Welcome to Section 2, Engineering Your Smile. This is where we properly meet the heroes of our story today. The crown and the bridge. So first things first, what in the world is a crown? The official definition calls it a fixed restoration that covers a tooth. But honestly, I think this analogy nails it. It's like a custom-fit helmet for your tooth. Its whole job is to restore the tooth's shape, its size, its strength, and just give it a whole new lease on life. And a bridge? Well, it's pretty much exactly what it sounds like. It's a prosthesis that literally bridges the gap from a missing tooth. It uses the healthy teeth on either side of that gap for support. You know, just like a real bridge uses those big pillars to span a river. Okay, before that bridge to work, it needs a super strong foundation, right? In dentistry, they call those supports abutments. An abutment is the natural tooth, or maybe an implant, that anchors the whole thing. They are the absolute crucial pillars holding that bridge in place.
And hey, don't just take my word for it. This is so cool. You can see these exact terms right here in the original notes we're working from: crown, bridge, abutment. We're really just decoding the technical jargon to make it make sense for all of us.
So who is this actually for? Like, when would your dentist recommend this stuff? Well, this slide shows the key indications. That's just the fancy term for when it's a good idea. It's perfect for fixing up badly broken teeth, for making things look better, or for stopping the other teeth from shifting around. And it's a fantastic option if you just want something more comfortable and solid than a removable denture.
But on the flip side, it's not a magic bullet for everyone. It's just as important to know the contraindications, which is when these things are not a good idea. For example, you can't build a bridge if you don't have those pillar teeth to support it. And if you grind your teeth a lot, or if oral hygiene is a struggle, it might not be the right path. It's all about finding the right solution for the right person.
And that leads us perfectly into our third section, weighing the options. This is where we get into the real head-to-head comparison, fixed solutions like bridges versus removable dentures. Okay, let's break this down. On one hand, you have fixed bridges. They're way more stable, they generally look better, and they're easier to just brush and floss like normal teeth. Plus, they don't tend to bug your gums. Then you've got removable dentures. They can sometimes feel a bit loose, food can get stuck under them, and for some people, it can even affect their speech. The day-to-day difference can be massive. So let's just boil it down. What are the big wins for going with a fixed option, like a crown or bridge? Simple. 1, it restores function, chewing, talking. 2, it restores how your smile looks. And 3, and this is huge, it helps keep your entire mouth healthy and stable. Okay, but let's be real, we need to talk about the downsides too. Fixed solutions cost more than removable ones, no doubt. The process also takes longer. And here's something from the notes that's really important. They are a permanent solution, but they're not necessarily a lifelong one. You can expect them to last somewhere around 7 to 15 years, and there's always a small risk to the teeth that have to be prepped to support the work.
All right, let's bring it all home and see how this actually happens. Section 4 is what we're calling your dental blueprint. Basically, a roadmap of what to expect on the path to getting your smile restored. So, before anyone even thinks about picking up a tool, there's a whole diagnostic process. It all starts with just a conversation, your history, your concerns. Then your dentist will do an exam inside your mouth and one of your head and neck. From there, they'll often make models of your teeth, called diagnostic casts, and of course take x-rays to see everything that's going on under the surface.
And again, this isn't some generic checklist we made up. You can see the whole process laid out right here in these source notes. It's a very careful, personalized approach to make sure the treatment plan is perfect for you.
You know, there's a line in these notes that I just love because it says so much. The chief complaint is recorded in the patient's own words. That tells you everything. The whole process, the whole journey, it starts with you, what you're worried about, what you're feeling. That's a patient-first approach, and that is exactly how it should be. And that brings us to one last thing to think about. Our notes give a little nod to newer tech like CAD/CAM, and it makes you wonder, right? With all this digital scanning and 3D milling, are the days of a dentist or a lab tech handcrafting a crown coming to an end? It's a fascinating question about where this amazing blend of art and science is headed. Definitely something to chew on.